It's a story of the left hand not knowing what the right hand is doing. The result has been billions of dollars in questionable Medi-Cal payments. Our guest is Elaine Howle, California's state auditor, whose office recently issued a report on what's ailing California's Medi-Cal program.
Additional funding for the Maddy report made possible by a grant from The Wonderful Company, harvesting health and happiness around the world. From the California channel at the state capitol and the Maddy Institute, it's the Maddy Report with Executive Director of the Maddy Institute, Mark Kepler.
Welcome. Recently, our guest, California State Auditor Elaine Howle, issued a report concerning $4 billion in questionable Medi-Cal payments, and is here to give us the details of that report. Welcome back to the Maddy Report.
Pleasure to be here.
So, first, tell our audience a little bit about California's Medi-Cal program. Who benefits? What does it cover?
Right. Medi-Cal in California is the California version of Medicaid. So there's a federal program that provides funding to states for individuals to receive health care and medical care. And it's typically older people, people who have low income. Medi-Cal is essentially the payer of last resort. So it's the ability for the state of California to provide medical benefits to low-income individuals in California.
And that program has been expanded recently.
Right. There was a major expansion under the Affordable Care Act, a huge expansion from 8 million beneficiaries in California upwards to 13 million.
Yeah, and your
huge increase.
55% increase. That is a huge increase.
In a short period of time.
So so Medi-Cal benefits come in two forms. There's managed care and there's fee-for-service. How does each of those work, and why has there been a push toward managed care?
Well, they're fee-for-service, first of all. Fee-for-service is essentially what it sounds like. So I go to a physician and I receive some type of medical care, and the state of California, through Medi-Cal, pays for that particular service that that physician provided to me. Managed care is more of a suite of available services for someone on Medi-Cal. And managed care, the push there is it's more preventative types of primary care, and it's a suite of services again, so it really encourages people to get to the doctor before it becomes an emergency, and it's more cost effective.
Which makes sense, right? If you keep people healthy, they don't spend as much on healthcare services, and then the companies do better, the people selling the insurance do better. In fact, I think I had read somewhere that the Chinese, you pay your doctor for when you're well, and you don't pay them when you're sick. That's kind of the same concept.
Right.
So how much does Medi-Cal cost, and who pays for it?
Medi-Cal in California is over $100 billion. Most of that money is coming from the federal government, but the state's general fund in the most recent year that we looked at paid about $19 billion. So it's a significant amount of money that California contributes towards the Medi-Cal program providing services for constituents in California.
But the federal government pays a lot, but that's
right.
changing, right?
Right. It's starting to change. The federal government over the last year has reduced the percentage that they provide. So by 2020, the state of California will have to provide an additional $1 billion to make up for the amount that the feds are no longer going to provide.
Originally, the feds are paying 100%. They're going to scale it back down to just 90%, but that's $1 billion more for the state.
Right.
Okay, so how is Medi-Cal then administered?
Medi-Cal is administered. The state of California, the Department of Health Care Services, is the primary state agency responsible for Medi-Cal, but where the rubber hits the road is out at the county level. So if I live in Fresno County, for example, and I go into a local county office and apply for Medi-Cal benefits, the county is the entity that's making the decision as to whether or not I'm eligible for those benefits. The state agency is essentially reviewing that information later and making the payments to the providers.
Okay, but the state agency pays the counties, what, $2.3 billion a year?
Exactly, and that's just to administer the Medi-Cal program. So that's to determine eligibility, report information to the state, that sort of thing. So a significant amount of money goes into just administering the program. And you're right, it's $2.3 billion to the counties for administration.
And so then the Department of Healthcare Service, the State Department, they would provide guidance and oversight? That's what they're supposed to do?
They are supposed to provide guidance and oversight with respect to how to conduct eligibility determinations, the kind of information that counties should be looking for. So the state has a little bit of oversight over the counties, but the counties are making the eligibility determinations and reporting those to the state.
But the state has to keep some kind of data source for that eligibility. The county has theirs, and they should match up. But you're finding that they're not matching up.
That's correct. That was the main concern in the report, why we said there were questionable payments, because the state system shows someone eligible, the county system may show them ineligible.
But they're
or
paid
vice
off. They're
versa.
paid off the state system, right?
That's correct.
Eligible.
So if
Okay.
someone shows up eligible in the state system, the state is going to pay the provider,
I think-
either through fee-for-service or managed care.
I think the word we're looking for is disconnect, right?
Yes.
There's a disconnect here.
Right.
So what is the process for resolving those inconsistencies between the state and county data systems for eligibility?
Well, and that's why it's important for the counties to be reporting the information to the state. So then the state system is compared at the state level to the county system. And if there is a discrepancy, then that information is reported back to the county, and the state expects the county to resolve it, to determine why is there a discrepancy. Is our information incorrect? Is the state's information incorrect? And what do we need to do to fix it?
And that was the break in the chain, it sounds like. Well, up next, we're going to talk about the agency that administers Medi-Cal, the State Department of Health Services, and why healthcare services, and why they were designated as a high-risk agency by the state auditor. How do they get that dubious distinction? That conversation in a moment. This is the Maddy Report.
Fresno State's Division of Continuing and Global Education is proud to serve the South Valley with its new accelerated Bachelor's in Business Administration degree, now offered in Visalia.
Welcome back. I'm Mark Kepler with the Maddy Institute. We're talking with Elaine Howle, California State Auditor, whose office recently issued a report finding billions of dollars in questionable Medi-Cal claims being paid despite eligibility discrepancies. So back in January of 2018, your office designated the Department of Healthcare Services as a high-risk agency.
Right.
What does that mean, and why did you apply it to the agency that administers Medi-Cal?
Well, when we designate a state agency as a high-risk agency, it's based on audits, a variety of different audits that we've done where we've identified problems and the department hasn't done its due diligence in trying to correct those problems. And one audit, or several audits that we've done on the Medi-Cal program, have found concerns with how they are administering the programs, and similar to what is in this report we're talking about today, eligibility issues. So we actually identified in an audit a situation where there were over 80,000 individuals, and our IT folks did an analysis and said there's a problem here as far as eligibility, brought it to the department's attention, and they hadn't really corrected that issue. So it's a laundry list of issues that we've identified over the years that we really haven't seen much progress in fixing. So that's why we designated them
What
high
I kind of
risk.
like about that, these high-risk ones, is you stay on it. It's not like you
That's
write a
right.
report and walk away. You say, listen, here's the problem, here's how we expect you to fix it, and you're going to come back and see if they actually fixed it.
Absolutely.
It's also interesting that it's not just you guys that have been talking to them.
Right.
The U.S. Department of Health and Human Services Inspector General issued an audit report as well. So they're on notice there's some issues here.
Right, and this is Medi-Cal, and it's called Medi-Cal in California, but Medicaid and the provision of services across the country is something that the Health and Human Services Agency, the federal government, is really focusing on, and the Inspector General for the federal government did look at California and issued a report shortly after we issued ours in January of this year, of 18, and they were really concerned about some of the things they found, very similar concerns to the ones we identified.
It seems that would have gotten their attention, but how much money are we talking about here? How many people are impacted?
Well, as you indicated, $4 billion was the questionable payments. Now, that doesn't mean that they were improper or inappropriate. Some of those individuals may ultimately be deemed eligible, but there's a discrepancy or a disconnect, as you said earlier. And it's over 450,000 beneficiaries who are still in that situation where the records at the county level do not match the records at the state level. So there's got to be some resolution done to determine, is this person eligible or not?
And the other thing you found, which was kind of interesting, is kind of the flip of that, where some people, 54,000 people, were declared as eligible by the state system, but ineligible by the county system.
Right,
So
exactly.
people possibly losing those benefits when they should be getting them.
Right, those individuals actually were eligible in the county system, not eligible in the state system.
Okay.
And the problem there is, when a provider is determining whether to provide services to an individual, they're checking with the state to say, am I going to get paid?
Okay.
If the state says they're ineligible, that person may be denied services, but the county is saying, yes, this person is eligible for Medi-Cal.
And this is a complicated area, for sure. So $4 billion was paid to managed care. How much of the $4 billion was paid to the managed care providers? Because you had managed care and fee-for-service.
Right.
How much was paid for fee-for-service providers?
Managed care was $3 billion, and that's evidence of the state is really pushing people into managed care. $1 billion was fee-for-service. Now, of the $3 billion, the state paid out about $700 million of that. A lot of it was federal money, but there's still a significant amount of money that the state of California is paying for these beneficiaries.
And if this continues, that's just going to be a bigger problem for the state budget because the feds are pulling back on what they're paying, right, from 100% to 90%.
Absolutely
payment.
correct.
Okay. So how and why did this happen?
Well, it happened because the system is set up so these exception reports. So when the counties report the information to the state agency, Healthcare Services, the two computer systems compare the records.
So it's all electronic. It's all in Excel spreadsheet, nice and neat, easy to use.
Right. Well, there's electronic information. The problem is once those discrepancies are identified, it's reported back to the counties. In some cases, it's reported back electronically. Unfortunately, in many cases, it's reported paper-based. So a county may get a big stack of
those old computer printouts that just go on and on and on.
And it would take forever to try to figure out, do we have a problem here? How do we reconcile this? So our recommendation in that case is you've got to make all of this electronic, make it easier for the counties, provide more guidance to the counties as to what they need to do to resolve these disconnects or
you have a really interesting example in your report about someone who had died.
Right.
And they kept paying, it was in a managed care situation, they kept paying the premium for 4 years.
That's right. So the family of that beneficiary who passed away notified the county, my family member has passed, so the county immediately went into the system and said, no longer receiving benefits, the person has passed away, but the state system didn't change, so the state's continuing to deem this person eligible, so when a managed care provider is billing the state, they're getting paid.
Right, and I think the number you came up with, that one case alone was $383,000.
Right.
That's a chunk of change.
Right.
So how long have these discrepancies and eligibility determinations and state payments existed? Is this a new problem, been going on for a while?
No, it's not a new problem. It's a problem that's been around for quite a long time. I mean, what our audit looked at was a 3-year window. So a lot of these individuals there's been a disconnect between the state records and the local county records for more than 2 years. And the state law really requires some of these decisions to be made, these eligibility determinations to be made within 12 months. So anything beyond a year is a significant problem. So we identified, I think it was 50-some-odd% of the over 200,000 beneficiaries have been
57%. You've got a good memory.
57%. Yeah, longer than 2 years. So we've got to get these situations resolved. Either deem the person eligible or deem that person ineligible and stop making payments.
Okay, a closer look at this report in a moment. This is the Maddy Report. The views expressed in the Maddy Report are those of the individuals participating in the program and do not necessarily reflect those of the California Channel or the Maddy Institute. If you'd like to share your thoughts about the points and opinions expressed on the Maddy Report, visit our website at maddyinstitute.org. Welcome back. I'm Mark Kepler with the Maddy Institute. We're talking with State Auditor Elaine Howle about an audit her office recently conducted on the problems in California's Medi-Cal program. There seems to be a discrepancy between the state and county data systems, like we were talking about, regarding who's eligible for Medi-Cal benefits. What factors contributed to these unresolved discrepancies?
One of the biggest factors that we talked about a little bit earlier is the expansion of Medi-Cal. So under the Affordable Care Act, more and more individuals were deemed eligible or could be eligible for Medi-Cal benefits. So that really increased the number of potential beneficiaries in the state for a lot.
Huge spike.
A huge spike, over 50%. So the counties, excuse me, were really overwhelmed with the workload. So that was one of the contributing factors to the increasing number of discrepancies between the records at the state level and the records at the local level. And then Covered California was having some issues with their data system, their computer system, so that was causing some problems as well. That has since been resolved, but it certainly was a factor that affected the volume of discrepancies.
Yeah, a lot of people thought that Covered California actually compared to other states, did a very good job in the rollout of the ACA. Just imagine what's happening in some of these other states.
Right.
Discrepancies in the Medi-Cal data didn't just result in paying questionable claims. It also, as we talked about earlier, led to the wrongful denial of services to those who were eligible to receive benefits. What did you find in that regard?
Right, so we talked about the over 450,000 beneficiaries where they were deemed eligible at the local level, or there's a discrepancy. We identified 54,000 individuals who were deemed eligible by the county, but when you look at the state records, they are not deemed eligible. So those are situations where an individual should be eligible for benefits, may be denied, or their benefits may be delayed. If they go to a provider and a provider looks at the state system and says, no, you're not eligible for Medi-Cal, I can't provide services, that it causes a problem. So there's over 50,000 individuals in that situation.
And you had an example there where this lasted for one person more than a year.
That's right.
Yeah.
That's right.
So your analysis, though, it excluded 2.6 million Medi-Cal beneficiaries. Who was excluded and why were they excluded?
Well, we looked at a particular program. We looked at Medi-Cal. So the other programs that were excluded use the same database, the same system that healthcare services. So it's like the CalFresh program, CalWorks program. So this is the same database
all the safety
at
net
the state
programs.
level. Exactly, all the safety net programs. So there may be individuals in those programs similarly.
They just extrapolate these numbers out. Wow.
Right, right. So we may have questionable payments there. We may have individuals who are being denied benefits. It's the same situation, but we couldn't look at everything. So we focused on Medi-Cal and the medical side of it as opposed to some of those other programs. We wanted to talk about those programs in the report because we want healthcare services to look at those as well.
Yeah, it's just, boy, think about all the potential issues out there. One of your findings was it wasn't that the state didn't have a process to ensure that counties were correcting these data discrepancies, but the problem was that they failed to check to see if the problems were corrected. They tell the county, hey, there's a problem, but not really follow up.
Right.
How were the counties notified that there were problems here?
Well, as we talked about a little bit ago, both electronically, there would be a report back to the county, but a lot of the reports were paper-based. Again, and as a county, you're getting volumes. We actually have a picture in the report of a stack of paper-based reports, and you can't sort through that. You have to do that manually.
It reminded me like when you saw computers like in the 1980s or something.
Exactly. So we are recommending healthcare services, you need to provide electronic reporting to the county so it makes it easier for them to sort information and really dig into those discrepancies and try to resolve them. And they're doing that for some counties now. So we're saying if you can do it for some counties, why can't you do it for all?
I think another, you give some great examples in this report. Another one is in this particular situation, LA County, which has 52% of the questionable payments, more than half. It takes them 2 weeks to manually process this voluminous monthly report they get from the state.
Right.
2 weeks.
Exactly. Exactly.
That's amazing.
Yeah.
So according to your report, last year the state paid counties $2.3 billion to administer this Medi-Cal eligibility program locally.
Right.
What has the state done then to ensure that counties are resolving these eligibility discrepancies in a timely manner? I mean, they're paying the money for the work.
Right, and that's where we feel Department of Healthcare Services has really fallen down on the job because they have a responsibility, number one, to provide appropriate guidance, provide information in a format that's going to be useful to the counties, easy for the counties to use, but then hold the counties accountable for getting those discrepancies resolved. And one of the things they are required to do is, okay, if a county is having problems and there's a lot of discrepancies, you got to put together a corrective action plan. We need to get these issues resolved timely. You're supposed to get them done within a certain time frame. You're not doing that. So we need a plan from you as how you're going to fix that. Healthcare Services is not doing that, and they need to.
Yeah, it's interesting. And you said 85% of the questionable payments were attributed to just 5 counties, Alameda, Los Angeles, Orange, Riverside, and San Diego. So
that's right.
That's where you might want to focus your efforts.
That's exactly why we put that in the audit report, because they were saying, well, there's 58 counties, it's going to take us a long time. So we took a look at that and said, if you just focus on these 5 counties, you're going to get the lion's share of the problems corrected.
Low-hanging fruit.
Exactly.
Okay, up next. So how do we fix the problems with Medi-Cal? The state auditor has some suggestions. That conversation in a moment. Welcome back. I'm Mark Kepler with the Maddy Institute. We're talking with Elaine Howle, the California State Auditor, about a recent audit her office conducted on California's Medi-Cal program, where they found $4 billion in questionable Medi-Cal payments. That's a lot of money. So your office highlighted some significant problems with this program, but you made some recommendations. You didn't just say problems. Here are the recommendations. What do you want to see the legislature do?
We made a specific recommendation to the legislature to require the Department of Healthcare Services to report out on how well counties are complying with state requirements to determine eligibility, number one, but number two, if there is a discrepancy, how quickly are they getting that discrepancy resolved? In both cases, determining somebody should be eligible and get benefits so that person isn't denied those medical services, but on the flip side, if someone is deemed ineligible, let's get that determination resolved so that we stop making payments.
Died, you don't make payments for 4 years.
Exactly. So we want the legislature to require healthcare services to report out on how well all of the counties in the state are doing in complying with those requirements.
It seems to make logical sense. So let's talk about this. So what can the state do about recovering these inappropriately spent monies, these funds? Can they recover that money, and how much can they recover?
In some cases, they can recover the money. It's going to be a little bit easier with managed care because they can build language into the contracts that allows them to recover payments. And the example we talked about earlier, the $383,000 for the deceased beneficiary, the state is trying to recover those funds, and hopefully the state will be able to.
You tell the managed care provider, hey, listen, you didn't provide the services, so reimburse us that money.
Reimburse us, or offset future payments. The state could do that. The concern we have and the difficulty the state's going to have is related to those individuals who are on Medi-Cal and they've been deemed eligible temporarily. So there's a process in the state where while the county is determining whether or not I'm fully eligible, I can get benefits, especially if I'm transferred from one program to another. Some people transferred out of SSI, their income is too high, but they may be eligible for Medi-Cal, so they don't lose benefits. They're in a temporary situation. Right. But if they are ultimately deemed ineligible, we can't get that money back as a state.
Because that's a federal law.
That's a federal requirement.
Federal requirement.
Yes.
Okay. So what about preventing future erroneous payments, as well as ensuring that eligible people receive the care that they should be getting? I mean, you talk about, for example, these exception reports is one that the counties get. How do we fix this problem?
Right, exactly. Well, healthcare services needs to provide better guidance to the counties, but they absolutely have to provide this information in an electronic format and then really work closely with the counties, reach out to the counties, particularly put an aging report together. We've had this discrepancy going for 3 months now. Fresno County, Sacramento County. What are you doing to fix this? So the state needs to do a better job in really communicating and working with the counties to make sure that these discrepancies get fixed.
But that's going to require probably some IT, information technology work. And we've talked about information technology in the state in the past. Any concerns that, I mean, to make sure they get this right?
Well, right, and the difficulty is the counties can use 3 different systems at the local level, and then the state has its system. But again, we argued with the department. We said you were able to provide this information electronically to X number of counties in the state. I don't recall the exact number. But if you can do it for some, why can't you do it for all? So you really have to focus on that. So we don't think there'll be significant changes that would need to be made on IT, but it's clearly an important thing to do.
You've got a template. Hopefully they'll go forward and use it. Well, I want to thank the State Auditor, Elaine Howle, for joining us again. If you want to stay current in state and local politics, you can follow us on Facebook and Twitter, or log on to our website at maddyinstitute.org. This is Mark Kepler for the Maddy Report. Thanks for joining us. The views expressed in the Maddy Report are those of the individuals participating in the program and do not necessarily reflect those of the California Channel or the Maddy Institute. If you'd like to share your thoughts about the points and opinions expressed on the Maddy Report, visit our website at maddyinstitute.org.